I'll turn the podium over to Dr. Becca Flyckt, my colleague and friend, who will talk to you about the infertility aspects of the procedure.
Thank you, Dr. Farrell. I just want to echo the sentiments of my colleagues in saying what an incredible privilege it's been to work with this team over the months and years leading up to our surgery. And although we're very pleased with the results of the surgery, we must remember uterus transplant is not just about a surgery and for moving a uterus from here to there. It's about having a healthy baby. And that goal is still a couple of years away. I just want to walk you through the project, which occurs over multiple steps. The first two steps are the screening and evaluation. And just to give you some perspective, our team has screened over 250 women to identify 10 that will ultimately have a transplant. What people don't understand about uterine factor infertility is that these women are born with normal ovaries that produce healthy eggs that grow and release each month just as they would in any other woman. The problem is that there is nowhere for these eggs to go. And so before a patient is listed for transplant, IVF is required to help a patient and her partner bank embryos that they can then use later. Each woman in our trial goes through multiple weeks of fertility injections to grow multiple eggs on her ovaries, which are then collected, fertilized with her partner's sperm, cultured in the lab, and frozen for them to use later. In order to be listed for transplant, each study participant must bank 6 to 10 mature stage embryos called blastocysts in order for her to be listed. The next phase of the protocol is the transplant itself, and I'd like to walk you through a brief animation just to show you how the transplant occurs. What you see here is the recipient's pelvis. She's been prepared for surgery, and in comes the donor uterus, which has been carefully prepared and placed on ice. The most important part are the vascular connections. So you'll see here to the sides are the uterine artery and vein. The uterine artery is what feeds the uterus. And these are carefully reattached to the recipient's larger pelvic vessels, which are the external iliac artery and vein. This part is crucial, and once a good blood supply is established, the uterus pinks up, and we're able to reconnect the vaginas of the donor and the recipient, and also give the uterus support by suspending it to some of the connective tissues of the pelvis. After a successful transplant is performed, let's keep in mind we have to wait 1 full year before even thinking about pregnancy. The woman is stabilized on anti-rejection medications, and once the team considers it safe, we begin to transfer those embryos one by one until we get to the goal of a healthy pregnancy. That pregnancy will be monitored by Dr. Perney and our high-risk team, and we hope for a healthy baby to be delivered by C-section. The patient can have 1 to 2 babies by C-section, and then that uterus will be removed. I hope this gives you a sense of the depth and the scale of a uterus transplantation project. And after hearing this, many of you may be thinking to yourselves, why would any woman want to go through all of this to have a baby? The answer to this question lies in speaking to these patients, talking to them and their spouses, hearing their experiences and their motivations. As a fertility specialist, I've been fortunate to have many of these discussions, and I'm happy to say that today you will also have an opportunity to hear one of these stories firsthand.